Hi friends, Dr. Arun Dhir here, and in this video we are going to be answering this question that I get asked so often, that what are gallstones and why do I need surgery to remove my gallbladder? See, we need to understand very clearly, gallbladder is an organ that has a function in our body. A lot of people think that gallbladder has got no function, it can easily be taken out. No, a healthy gallbladder has a function. However, a diseased gallbladder, just like any other organ in the body, when it becomes diseased, needs to be treated. The function of the gallbladder is to store bile. It does not make any bile. It just concentrates the bile which is required for digestion of fats in the body. Now, when a gallbladder is not functioning properly, the reason most of the times that it starts to form stones is the gallbladder wall, which has got the function of concentrating the bile. That function is getting lost, and that is why the stones begin to form, and most of these stones are cholesterol stones. These stones can sometimes sit very silently in the gallbladder, or at other times they can cause pain, and this pain can sometimes not just be in the area where the gallbladder is, which is just above the liver on the right side of your tummy, but it can also be a referred pain, which means it can go to your shoulder, it can even go to the chest, suggesting that you might be having a heart attack, or sometimes it can radiate to your back. So these are called referred pains. But sometimes gallbladder stones can present with bloating, indigestion, what we call as dyspepsia. So, as I said, the stones in the gallbladder reflect that gallbladder wall functioning has lost. If treatment was directed just to remove the stones will form again, because the concentration ability that is there in the gallbladder wall has been lost. Most of the times, an ultrasound is the investigation of choice that allows you to pick up these gallbladder stones. But let's look at it. What are the risks of having surgery and risks of leaving gallstones alone and not doing anything about it? See, the gallbladder is connected to the common bile duct, which runs down all the way to the intestine, and at its lower end it is joined by the pancreatic duct. So when these gallbladder stones, when they are very tiny stones, and I say tiny stones are more dangerous than the larger ones, because the larger ones cannot move around a lot. They've been there for a long time and they just sit in the gallbladder itself. However, these tiny stones tend to drop down and they create irritation to the pancreatic duct and to the pancreas itself, which can lead to a condition called as pancreatitis. Now, some of you may have heard pancreatitis can be a very dangerous and a life-threatening condition. The other problem with leaving stones as is these stones can drop into the main bile duct, causing blockage of the whole biliary system, which is the system that connects it to the liver. And what happens is people get jaundice, they can get fever, and that can lead to infections. And once again, a condition called as cholangitis can set in, which is again a dangerous and a preventable condition. But what is more important is the effects that gallstones have on the overall quality of life of the individual. See, these stones can get and they can block the cystic duct, which is the duct of the gallbladder itself, and create that sharp attack of pain. You could be on a holiday, you could be traveling somewhere, you could be at some friend's place, and you could have the gallbladder attack. Doesn't necessarily mean that having fat-free meals allows you to reduce the risk of developing a gallbladder stone attack. What about surgery then? See, I recommend that people who are fit and healthy for a general anesthesia should consider surgery. Not that because I'm a surgeon and I'm trying to push for surgery, but on the basis of merit, the efficacy of treatment, the best result or return for the risk that is associated with surgery is least, and you have the best possibility of return. We do the surgery with keyhole techniques, or also called as laparoscopic surgery or telescopic surgery. It involves one night stay in the hospital, and generally people are home the next day and they're back to their usual activities within 10 days or so. During surgery, we also perform what is called as an intraoperative cholangiogram. It is an X-ray to make sure that the bile duct is clean and there are no stones that are left behind. Now, People often come and ask me, what is this post-cholecystectomy syndrome, which means it's a syndrome basically where some people, a very small tiny fraction of people, may develop a symptom where they get bloating, they get diarrhea, they get dairy intolerance after removal of the gallbladder. And this is primarily because the bile is flowing directly into the small bowel without any regulation, without the presence of the gallbladder to concentrate it. It is a very small percentage of patients who actually get this syndrome, and I personally don't believe that it is something that we should be basing all our decision making on. Gallbladder surgery is safe, it is effective, and if someone's got a gallbladder that is packed with stones, it is giving them symptoms time and time again, I will strongly say that gallbladder surgery should be considered. Also, in the event that individuals have got silent gallbladder stones, that means these stones are just sitting there, they're not creating any problems. But in those situations, if an individual is diabetic, then it is critical that they consider surgery, because diabetics, as you probably know, have got a compromised immune system, and these gallstones can create impaction, which is blockage, and they can cause suddenly progression to a significant infection, which can be dangerous in diabetic individuals. And the last but the probably most important aspect of gallstones, which are not treated and they just keep getting bigger in size, are their association with gallbladder cancer. Studies have proven that gallstones that are more than 3 centimeters in size are more likely associated with gallbladder cancer. So I guess for a problem that is relatively I shouldn't say simple to treat surgically, because every surgery has got its own risks associated with it. I would say surgery is effective. Talk to your treating practitioner, talk to your surgeon, talk to your general practitioner about what is the best option for you. I hope you liked this video and found it informative. If you did, please subscribe to my channel and share this video with whoever you think might benefit from this information.